Dr. Ali, a board-certified OBGYN, and we're going to talk about why I recommend low-dose aspirin in some pregnancies. Low-dose aspirin is recommended to delay or prevent the onset of preeclampsia. This is an 81 milligram baby aspirin, and it's recommended to start it in the late first trimester at 12 weeks, and you continue to take it until you deliver. Here's a list of criteria of who should be taking this baby aspirin. This is going to be broken down into patients that have a high risk of developing preeclampsia and then a moderate risk. If you have one or more of these risk factors for the development of preeclampsia, we recommend you take a daily baby aspirin. Number one being a history of preeclampsia, multiple gestation, so anyone who has twins, triplets, or higher order pregnancies. Chronic hypertension, so if you have high blood pressure outside of pregnancy or hypertension outside of pregnancy, then we definitely recommend it as well. Type 1 or type 2 diabetes, anyone with renal disease, anyone with an autoimmune disease, particularly lupus, or antiphospholipid syndrome. For those with moderate risk factors, if you have one or more of them, you can consider starting a baby aspirin. Definitely something you want to discuss with your OBGYN. Nulliparity, meaning this is the first time you've ever been pregnant. A family history of preeclampsia, particularly in your mom or your sister. If you are African American, if you're older than the age of 35, or if you have a history of a prior pregnancy where the baby had a low birth weight, they were small for gestational age, you had a prior adverse outcome in your pregnancy, or there's been a greater than 10-year gap between your pregnancies. How exactly does baby aspirin work to prevent or delay the onset of preeclampsia? You know that aspirin is an NSAID. It works to inhibit COX-1 and COX-2, and it has both anti-inflammatory and antiplatelet properties. Stay with me here. This is going to make sense, and it's really cool the way it works. COX-1 regulates production of prostacyclin and thromboxane A2. At a lower dose, aspirin works to decrease platelet synthesis of TXA2 without affecting vascular wall production of prostacyclin. When you give aspirin at a low dose, it's not going to inhibit everything. It's only going to inhibit and decrease platelet synthesis of TXA2. We know that TXA2 is a potent vasoconstrictor, and in studies, it has shown that an increased level of TXA2 can lead to the development of preeclampsia. A higher dose aspirin is going to inhibit it all and not be that selective inhibition. Because the human body is just fascinating. And so is modern medicine. The evidence shows that in the development of preeclampsia, for some patients, there is this imbalance between prostacyclin and TXA2. This imbalance led to the development of preeclampsia, which is why if a low dose aspirin can inhibit that TXA2, then the chance of developing preeclampsia lowers. Now that was a lot of information, but I hope it made sense. I hope you learned something new today, and I'll see you in my next video. Bye.